Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. We're talking about advances in orthopedics at St. Luke's University Health Network. Today we'll be joined by a talented panel of experts from the field. Stay tuned, this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at advances in orthopedics at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Justin Miller, who hails from Yardley, Pennsylvania, and is an orthopedic surgeon with subspecialty training in musculoskeletal oncology. He completed his medical degree at Philadelphia College of Osteopathic Medicine, followed by a residency in orthopedic surgery at Rutgers RWJ Jersey City Medical Center. He went on to complete a 2-year fellowship in musculoskeletal oncology at Morristown Medical Center, where he learned how to diagnose and treat both benign and malignant musculoskeletal tumors. While he enjoys performing general orthopedic procedures, his true passion is in treating a broad variety of both simple and complex bone and soft tissue tumors. Thanks for being here, Dr. Miller.
Thank you so much for having me.
So before you became an orthopedic surgeon, you were an algebra teacher. Tell me a little bit about the shift and why you went into medicine and your choice to pursue orthopedic surgery.
I had all these goals as a teenager and a child, and I wanted to be a teacher growing up. I enjoyed math and science and interacting with other children and people, and so I enjoyed teaching. I went to Bloomsburg University and had an elementary degree in elementary education, and came out and got a very good job, enjoyed it, but really I felt this yearning to do something more. And one day I had an epiphany and I decided to change careers, quit my job, and go back to school to study medicine.
Pretty amazing, and there is a lot of teaching in medicine as well, not just being a student, but also teaching as you go through. Have you found that being a teacher first was helpful in going into medicine?
Absolutely, and that's the thing about medicine. It's a constant growth of knowledge. You never stop learning. You have, residents, medical students, people below you, or other team members and on your equal that you can learn from and also teach. I can act, I can perform surgery, and I can do many things all at the same time.
That's awesome. Thank you so much for being here, Dr. Miller.
Thank you.
Joining our panel next is Dr. Gregory Gilson. A native of the Lehigh Valley, he completed his medical degree and orthopedic surgical residency at the Philadelphia College of Osteopathic Medicine. Dr. Gilson worked with well-renowned leaders in both hip and knee arthroplasty throughout the Philadelphia, Baltimore, and Boston areas, and developed a passion for the ability of hip and knee replacements to restore function and improve patients' lives. After residency, he pursued a fellowship in complex hip and knee reconstruction at the University of Maryland and the Rubin Institute of Advanced Orthopedics. Thank you so much for being here, Dr. Gilson.
Thank you for having us, Ashley.
So you treat patients who come to you with knee and hip pain. Why did you choose this field within orthopedics? What spoke to you about it as a subspecialty?
One of the biggest things is you see people come in and they've gone through all the non-operative process, or they've meeting you for the first time they've had any diagnosis of hip or knee pain, arthritis, anything from that standpoint. I get to see them through that entire journey and see them through the conservative management and then possibly the operative side if it comes to that point. And it's hip and knee replacement are one of the, I think, best operations we do in terms of someone who has debilitating pain that's affecting their daily function and able to get them back to doing what they want to do.
It must be incredibly rewarding to see someone come in pain and whatever treatment you choose and work with them on, coming around to feeling so much better and getting back to their lives.
Yeah, and it's a partnership that, either with surgery, without surgery, that you make with your patients for life. So it's really rewarding.
Thank you so much for being here, Dr. Gilson. Let's meet our final panelist, Dr. Colin Whitaker. A native of Bucks County, Dr. Whitaker completed his medical degree at Drexel University College of Medicine and his residency at Albert Einstein Medical Center. He then completed a fellowship at the Hospital of the University of Pennsylvania, where he became highly trained in both reconstructive spine deformity procedures, robotic surgery, and motion preservation surgery, including arthroplasty, laminoplasty, and minimally invasive surgery. His extensive training provided him with the experience to care for a vast array of spine pathologies, including degenerative conditions of the cervical and lumbar spine, traumatic injuries and infections, and metastatic tumors of the spine. Thanks for being here, Dr. Whitaker.
Thanks for having me. It's a pleasure.
So you specialize in neck and back pain. When you became an orthopedic surgeon, why was this the subspecialty that you chose, and what do you like about it?
It's a very challenging subspecialty within orthopedics. Patients typically have a lot of pain. Typically they have a lot of medical problems as well. Being able to guide patients through their journey and trying to figure out the correct diagnosis and which treatment fits them best is highly rewarding.
It must be amazing when someone is almost debilitated, especially with the spine, to see that change. Do you feel that you have a lot of opportunity to help people get better in this field as it continues to advance?
Absolutely. Patients sometimes come in with terrible pain in their neck, in their arms, the inability to walk. So being able to get them back on their feet, getting them up and walking, back to doing things they love is great.
Well, thank you all for being here and giving us such great background information on why you do what you do. But up next, we're going to dig deeper into some of the common conditions and orthopedic treatments available at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
At St. Luke's Orthopedic Care, you can trust us with your hands, feet, shoulders, hips, and knees. Because healthy bones and joints mean you can do more. You can trust us to recommend the right approach to care, including joint-sparing treatments and therapies. And when surgery is the only choice, we offer options to help you heal faster, including technology-assisted joint replacements and muscle-sparing hip surgery. St. Luke's, the orthopedic care you trust, now more than ever.
I've been a carpenter now for 44 years. I had my own business for 25 years in home remodeling. I work in high-rise buildings every day. So you walk up and down steps all day long. That's where all my energy goes. My knee started hurting. Next day, we were in the emergency room, and that's how we got to St. Luke's. They opened up my leg, they cleaned the infection out, and then Dr. Gilson, he's like, your infection's back, your knee's got to be replaced. It was easy to go from surgery at St. Luke's to physical therapy. By the time I got here, I was already walking, but I didn't have very much motion. And I only had 7 visits with him. When you're a carpenter and you walk all day, when you're not walking, everything in your life is on hold. There is no life. I would recommend St. Luke's because they replaced my knee and I was back to work in 3 weeks. That's not heard of. I feel good, and I'm happy with all the care that I had.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Justin Miller, Dr. Gregory Gilson, and Dr. Colin Whitaker. We've learned about your expertise, so now we want to dig a little bit deeper into orthopedic services that are available at St. Luke's. Dr. Whitaker, let's start with you. How common is it for adults to experience neck or back pain at some point in their life?
Sure. So it's extremely common for adults to experience either neck or back pain at some point in their life. The neck is made up of cervical vertebrae and discs, and as well as the lower lumbar spine is made up of vertebrae and discs. Over time, those degenerate. That's just part of the aging process. With that, you get pinched nerves, which can cause pain in your legs or arms. And at some point, patients will typically have this throughout their life and need treatment.
When do they know to see a doctor, and what are some of the most common conditions that you're treating?
The most common disease that we treat is something called degenerative disc disease. Typically, patients will have some sort of pain in their neck or back. You want to really reach out to your doctor when you're having prolonged pain for multiple weeks and it's not responding to Tylenol or Advil or non-opioid medications, or when you're having pain that's in your legs, such as radicular pain, which is burning, or numbness.
Yeah, certainly don't ignore burning or numbness or not responding to pain meds. All right, well, Dr. Gilson, I'm going to move to you as a joint replacement specialist. What is your treatment approach, and how do you determine when someone actually needs a replacement of a joint?
A lot of patients come in the office and they're at the very beginning of their journey, or they've seen someone else and have been kind of referred to discuss joint replacement a little bit more. But we start down the conservative pathway and we exhaust the conservative measures, because surgery, we want to be the last kind of resort. It's kind of at that point. We start with physical therapy, anti-inflammatory medicines, sometimes injections of the hip or the knee. And then when all that has kind of failed, it's then a discussion about joint replacements. And I tell patients it's really them making a decision. Now, I won't tell anyone they need a joint replacement. I say, you will tell me when you need one, or it's kind of gotten to that point and you are a candidate for it.
I certainly have known many people who have had either a knee or a hip replaced, and they do seem to know when it's time and they just can't live with the pain any longer. But how long can they expect it to last? Will it last a lifetime? When does someone need to be concerned that they might need it replaced at another point again?
Yeah, so the implants we were putting in 15, 20 years ago, and we were hoping that they'd last 15, 20 years, and a lot of them have. And the parts have gotten better and better over time, that on the hip and the knee side, we're hopeful that they last patients a lifetime, because the bearing surface has gotten that much better, aside from, traumas or infections or anything like that that are kind of things that we don't expect.
Which is really good news for patients who might need a hip or a knee replacement. Thanks so much, Dr. Gilson. Dr. Miller, what about you? You are one of only 200 orthopedic oncologists in the country. How did you go into this subspecialty, and what does it really entail?
So orthopedic oncology entails treating patients from the pediatric population all the way through the elderly population in any part of their body of the musculoskeletal system: hands, feet, upper extremities, lower extremities. And what that covers is patients who have tumors, benign tumors, soft tissue tumors, malignant tumors, such as a sarcoma, or even metastatic disease. So elderly or older population patients that have maybe breast cancer that went to the bone, and then I would surgically treat that, remove any of the tumors, or possibly reconstruct their limbs with limb salvage procedures.
When a patient hears oncology, they think cancer, but you also see patients, you mentioned benign tumors. Can you tell us a little bit more about that and why someone maybe shouldn't be super fearful to come see you?
You shouldn't be fearful, but also you should always be vigilant about anything you find on your body. If you find a lump or a bump on your body, you should get it checked out, whether it's either a dermatologist or myself as an orthopedic oncologist. There are multiple different types of benign tumors of the bone and the soft tissue that would possibly need to be removed versus monitored closely over time with routine imaging to make sure it doesn't change. Almost like the way a dermatologist would follow a mole, I would follow it with an MRI over time.
Nothing more important than listening to your body and seeing your doctor and getting checked out. This is great information from all of you, but we're not done yet. After the break, we'll learn more about new technology and programs offered at St. Luke's. You're watching St. Luke's Health Now. Stay tuned.
The team that we have put together of sport performance coaches and athletic trainers is why parents should choose St. Luke's University Health Network for their sport performance needs.
St. Luke's and our coaches are going to provide the safest and most comprehensive training environment that a student athlete would want. And I don't think there's anything in this area that can rival it.
I first started noticing pain in my hip early in this year. I thought I maybe pulled something, but it just progressively got worse pretty quickly to the point where I was limping. That took me to the doctor initially. I made an appointment with ortho. They suggested that I have an injection to see if that relieved anything. So I set that up, did that injection. I had beautiful relief, but it only lasted 2 weeks. In the meanwhile, I learned Dr. Wachuku was a doctor who did anterior versus posterior, which I was really interested in because recovery time is shorter, and that's what led me to Dr. Wachuku. Everybody at Ortho from A to Z was extremely, extremely helpful. And I was physically out of the hospital shortly after lunchtime on the very next day. I am walking outside. I've been walking outside for 2 miles, probably within about 2 weeks post-surgery. My surgery has changed my life because I felt like it was going to make me feel old. I felt like it was going to slow my lifestyle down. It hasn't really changed my life that much. It's actually better because I'm doing that pain-free now. St. Luke's Ortho and St. Luke's PT has really helped me get back on my feet pain-free.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about advances in orthopedics at St. Luke's University Health Network. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Justin Miller, Dr. Gregory Gilson, and Dr. Colin Whitaker. Thank you all for being here. In the first part of the program, we talked about your backgrounds, the services you offer, and why you really got into the fields. But now we'd like to dig a little bit deeper and talk about actual treatments and technology that is offered at St. Luke's. Dr. Miller, I'll start with you. Orthopedic oncology, you told us a little bit about what that is. Can you explain to us if someone is diagnosed with a tumor of the bone or soft tissue, what they can expect in that first appointment, and what follows a biopsy or a diagnosis for them?
So first off, they should expect that I'm going to treat them like a member of my family, that I'm going to do everything I can in my power to make sure they feel comfortable with my team, and comfortable with my treatment approach. Secondly, it can be a long-running process because it may involve biopsies, which may take time to find the final diagnosis, and which then I would know the surgical plan or come up with the surgical plan. So it can be kind of a long process. There needs to be a little bit of patience, but I'm there with you the entire way. And how that helps is that I'm able to quarterback a lot of the different subspecialties that the patient may need, whether it comes to radiation oncology or hematology oncology, and as well as myself, the surgical orthopedic oncologist.
And I would imagine that that team approach and communication is so important to patient outcomes. When someone needs surgery on their bone, and they think about a tumor and they think about possibly it being malignant, what are some limb preservation techniques and reconstruction that you can utilize to help people hopefully save their bone and save their limb?
Correct. So I was trained on limb salvage, right? So, you know, the only amputation is the last of the last of the last options. So we've, with the modern technology and the internal prosthetics that have been developed over time, it's extremely rare that I would have to resort to an amputation. So taking out the area of the bone that may have the cancer and completely reconstructing it with metal and plastic in order to keep the patient up and moving and walking right away after surgery.
That's really incredible because no one wants to have to lose a limb, and if there's techniques and technology that allows you to salvage it, that's really incredible stuff. Dr. Gilson, I'd like to turn to you. You mentioned the joints of hips and knees lasting a lifetime now. So what are some of the newest technologies that are available for joint replacement? I know that people are up within a few hours, I hear. So tell us about the advancements that have come so people might be less concerned about the need for a replacement.
Yeah, so the advances have come in some of the technology, so on the knee side with robotic assisted, and on the hip side with robotic or computer navigation assisted to help position implants appropriately for longevity of the joint replacements. The thing that has been kind of the biggest innovation in joint replacements has actually been the fixation methods of them, and more importantly, the actual plastic that is within them, essentially as a bearing surface for decreasing wear over time, because the wear over time can then degrade the implants, which can then lead to loosening over time and need of revision. So that's where the most innovation has been on the joint replacement side of the hip and knee.
People talk often about knee replacement, but what about knee reconstruction? When is that needed, and what is really the difference?
Sure. So they are a little synonymous. Knee reconstruction we talk about sometimes with sports ligamentous injuries, where you're reconstructing an ACL or a PCL or ligaments around the knee, that we hear kind of athletes and sports literature of people who are out for a season because of their ACL tear. You can also talk about joint replacements as a reconstruction procedure because you're reconstructing a joint that's worn out. And there can be reconstructions on the first time or the reconstruction of a previous joint replacement as well.
Very interesting and important for patients to recognize that there are many treatment options available to them. Dr. Whitaker, you mentioned in the earlier part of the program the complexity of the spine and how many people can suffer from back and neck pain. So what is your approach to care, and what is the specialized training that you have treating conditions of the spine?
Sure. So my approach to spine care is largely conservative care. Most patients who come in to see me don't need surgery, but they do need to be directed into the right place to get their treatment, such as an injection or physical therapy. I like to exhaust all non-operative care first, unless it's an emergency.
And what are some of the approaches and technologies that are now available at St. Luke's for people who might need spine surgery as an option, but maybe not?
Sure. So this is actually one of the most exciting areas of spine, and we actually get a lot of our new technologies from our joint replacement colleagues. Instead of fusing the spine, we're actually doing disc replacements. So it's like a knee replacement, but for your spine. You can preserve motion while making sure that your nerves are protected.
That's amazing. And does that work in conjunction then with physical therapy for their continued care?
Absolutely. Most of my patients who have surgery afterwards need prolonged physical therapy to really maximize the results.
Excellent. Well, thank you all for such an engaging conversation. Up next, we're going to take questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about advances in orthopedics at St. Luke's. Now we will read some questions from our viewers. Are you guys ready?
Yeah, let's do it.
All right, Dr. Gilson, I'm going to start with you. This viewer writes, I'm 72, relatively active and in good health, but I had knee replacement surgery 20 years ago. I was told it would last 20 years. Do I need to have the surgery again? And if I choose to have revision surgery, can I expect the same lifespan for the implant, or will I need another one?
That's a great question. I see this, actually, I get this question all the time in the office because 15, 20 years ago, patients were told, I expect your joint replacement to last 15 or 20 years. And do some of them last right around that time? Sure. Have some of them been a little less? Most have been more. Because it's predictive. It's a predictive algorithm as to how long something's going to last. So it's not a ticking time bomb of, I hit 20 years, I need this knee replacement or hip replacement redone, but it is good to have routine surveillance. So that's where I follow everyone after I've done a joint replacement at intervals afterwards with serial x-rays to make sure everything's acting like it should and that they're not going to develop an issue if we wait. If you need a revision, a redo knee or hip replacement, we actually expect the implants to last longer now because the technology has gotten better than it was 20 years ago.
That is excellent news, and certainly I would say probably listen to your body, right?
Absolutely.
Things are working, keep going. Yeah. All right, Dr. Miller, this is for you. This viewer writes, my brother was diagnosed with a benign tumor in his thigh bone and was told he does not need to have it surgically removed. Is it common not to remove it, and at what point might surgery be needed?
So it's extremely common to not have to remove a tumor if it's been diagnosed or it is definitively benign on advanced imaging. So there are certain different types of tumors, whether they're an enchondroma, which is a benign cartilage tumor, things like that, that can just be monitored with routine images and x-rays. And the only time that it would need to be surgically removed if there is a change in that serial x-ray or serial imaging that I'm obtaining, in order to look for a change. If something's changing, then it's probably not benign.
Probably somewhat disconcerting that you can feel it, but again, keep monitoring it and see
Correct.
What needs to be done. Okay. Dr. Whitaker, I think this is for you. This viewer writes, I was diagnosed with spinal stenosis several years ago and take medication to relieve nerve pain and reduce inflammation. Are there any treatments that you would recommend that would lessen my dependence on these medications? That's a biggie. A lot of people want to get off of pain meds.
Absolutely. One of the big treatments that I refer my patients to, typically before any type of surgical treatment, is spinal injections. So that's typically done by some of our colleagues in the spine and pain world who do an injection directly into your spine and deliver anti-inflammatory medication right at the site. So that can actually help reduce the amount of medication you have to take every day.
Well, that is certainly good news to reduce that medication. Dr. Gilson, for you. I've had pain in my hip for about a year, but it's getting worse. My doctor recommends a hip replacement. Should I consider it?
I think it's a conversation we have that I have all the time. The people come in and they say, someone has told me that I need a joint replacement. And I come from the side of we're going to exhaust all conservative things first. I never tell anyone they need a joint replacement, but we go through the pathway of what a joint replacement is, what the outcomes are, and what the expected benefits of it are.
That's good news because there are a lot of options before the replacement. Great. All right, Dr. Miller, this viewer writes, is surgery usually the primary treatment for cancers of the soft tissue, and what is the potential for a cure if I get surgery?
There's two different types of tumors that you could be removing in general, right? Benign tumors that you want to remove just for functional purposes, or whether they're impeding on a nerve or a neurovascular structure, you'd want to remove those just because they're causing issues. You can remove that tumor without taking any other tissue, right? But if you are removing a soft tissue tumor that's malignant, then you need to take that tumor out with a wide margin around it so that you get very clean tissue, you don't leave anything behind. There's definitely potentially a cure for those malignant tumors, and sometimes that comes along with other treatments such as chemotherapy or radiation therapy.
Excellent, so very personalized medicine.
Correct.
All right, Dr. Whitaker, last viewer question we have here, and this is for you.
All right.
My mother-in-law was diagnosed with a compression fracture of the spine due to osteoporosis. She's in her late 60s. Would you recommend surgery for her at this age, or will this typically heal on its own? I think this is really important because a lot of people, primarily women, suffer from osteopenia or osteoporosis, which can cause a lot of problems for neck and spine.
Absolutely. This is something I see almost on a daily basis, and it is typically in the 60, 70-year-old women with osteoporosis, which is weakening of your bones. Typically, these do not need surgery. They heal on their own with a brace and just time. We'll monitor it with x-rays and make sure that the patient is functioning. But the biggest thing you can do is see your family doctor or an endocrinologist to be evaluated with a DEXA scan and get treated.
Excellent, excellent advice. Before I let all of you go, I'd like to ask each of you, what are you most excited about in your field, and what do you find most rewarding about what you do every day? Dr. Miller, I'll start with you.
I'm most excited in my field about being able to really change a patient's life when they are diagnosed with a dramatic, life-changing diagnosis. So I'm able to remove that, possibly cure them, and save their limb and also their life, and that really gives me benefit in my own life, and it returns twofold.
Excellent. Dr. Gilson, what about you?
One of the most rewarding things is I see people through their whole journey of arthritis from the very beginning through their end stages of arthritis where they're considering joint replacement, through joint replacement, and then they're my patient for life. So I see them on a regular basis, which I think is really rewarding because you build very good relationships with your patients.
That must be a great part of the job. Dr. Whitaker, what about you?
Sure. So some of the biggest advances in spine surgery have to do with the way we treat patients and getting them in and out of the hospital, sometimes the same day. Our surgeries now are less invasive, and if we can get people better with smaller surgeries, faster recoveries, then they do a lot better.
It is amazing what is happening, the technology, your training and expertise. We're so grateful to have you here at St. Luke's and in our region. Thank you all for joining us, and thank you all for watching. For more information on orthopedics at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.